Hi guys, welcome back to the channel. Let's continue with maxillary sinus. Today we will be dealing the general examination. If there is any disease, I will be knowing that there is something in maxillary sinus, and we will dealing about the acute sinusitis. There are two types mainly, acute and chronic. Acute sinusitis we will dealing in today class. So let's start. Now coming to general examination, extraoral examination, there will be pain, tenderness and swelling. Okay. Intraoral examination, pain and tenderness and swelling over the canine fossa and zygomatic buttress. Okay, this swelling can be seen extraorally also, intraorally also. Extraorally also there can be pain and tenderness over these regions, and intraorally also. Okay, now there is a trans-illumination technique which is very important in maxillary sinus diseases, which shows decreased transmission due to accumulation of fluid, pus, etc. Okay, what it shows? Trans-illumination shows decreased transmission due to accumulation of fluid plus etc. This is the most important diagnostic thing. Okay, trans illumination. Now radiology, which radiograph we can go for? We can go for PNS view, lateral skull view, PA Waters view, that comes under only PNS view. Okay, occlusal radiographs, linear tomography, periapical radiograph or CT scan in extreme cases. But PA Waters view is mostly used for maxillary sinusitis or maxillary thing. Okay, we can go for CT scan in extreme or severe cases. Now let's start maxillary sinusitis. Today we will dealing acute maxillary sinusitis. Okay, what is sinusitis? In layman term, it is the inflammation of PNS. Whenever there is itis in anything, in any end, these itis represent inflammation. What does represent? Itis represent inflammation of anything. Okay, so inflammation of sinus is sinusitis. Itis represent inflammation. Okay, what are the causes? It is the general causes of maxillary sinusitis. First causes upper respiratory tract infection very frequently, then odontogenic infection. If there is any oroantral communication or fistula, if there is allergic rhinitis, okay, facial trauma, mid-face trauma, foreign body entrapment in sinus, or neoplasm or cyst of odontogenic origin. Okay, what are the types of maxillary sinusitis? It can be acute, subacute, recurrent acute or chronic. We will be discussing acute and chronic. Subacute and recurrent acute is a transient phase, so we will not discussing this. Okay, now coming to acute maxillary sinusitis. What are the signs and symptoms of acute maxillary sinusitis? Firstly, there will be history of cold 3 to 4 days prior to the acute attack. Okay, history of cold 3 to 4 days prior to the acute attack. There will be heaviness in head, a throbbing pain aggravated by head movement, coughing or sneezing. Okay, हेड भी भारी लगेगा, हैवीनेस रहेगा और एक थ्रॉबिंग पेन होगा जब कोई भी पेशेंट अपना हेड मूवमेंट करेगा, इधर उधर रोटेट करेगा या कफ करेगा या स्नीज करेगा. ओके, these are we are studying about acute maxillary sinusitis. Now there will be a mild swelling of cheek in severe infection. Teeth in relation to maxillary sinus may be painful or shows tenderness on percussion. Okay, teeth can be painful or can show tenderness on percussion. ठीक है, tenderness over the cheek can be also felt. Now PNS water view is used to show the fluid level. Rhinoscopy may reveal pus draining downward, or it can reveal erythema of mucosa and pus discharge following onto the inferior turbinate. Okay, PNS water view and rhinoscopy. Now coming to the management, we have dealt the sign and symptoms, we have dealt what to use, which radiograph is to be used, and now what are the management. Firstly, there is antral regimen, which include bed rest, plenty of fluid, and maintenance of oral hygiene for 5 to 7 days. Okay, bed rest, plenty of fluid, maintenance of oral hygiene for 5 to 7 days. We have been dealing about fluids control in some other class, but remember there is fluid is very important in any of the management. For example, shock, these maxillary sinusitis, wherever there is fluid loss, fluid management plays a very important role. It should be followed. Okay, in simple dehydration or diarrhea, we have to follow fluid management to maintain the balance of sodium and salt in our body. Okay, this was about antral regimen. Then antibiotics of choice, either we can go for cephalosporins or we can go for clindamycin or any penicillin. Okay, this is about the choice, antibiotic of choice. Decongestants. What do decongestant do? It improves the opening, that is ostium opening, by decreasing the vascularity of lateral walls so that the pulse of fluid which is accumulated, it can be discharged easily, so there is no heaviness. Nasal drop or spray, obviously 0.5 to 1% in normal saline, we mix it and use. ठीक है, what we use, xylomethazolene hydrochloride 0.1% drop. Which drop we use? Xylomethazolene hydrochloride 0.1%. Okay, then we have to use mucolytic agent to decrease the mucus secretion or release the mucus secretion, to reduce the viscosity of the secretion, obviously. For example, injection benzoin or camphor can also be used as a mucolytic agent. And lastly, NSAIDs for pain control. Okay class, this is all for today. We will be dealing with chronic sinusitis tomorrow, and maybe we will be starting with OSC or OAF tomorrow. Okay, till then, like, subscribe and comment. Bye.